Okay, great. So I've had my initial visit and I kind of know what to expect right after that. So after the initial visit, kind of what's the next step? How many treatments can we expect it to take to resolve the issue?
That's great. So again, we don't know, everybody responds differently. What I do know is based on my own clinical experience and based on the condition that we're treating, I have a sense of what our initial course of treatment should look like. So that initial course of treatment may be 4 weeks, maybe 6 weeks, maybe 8 weeks. We have some initial course of treatment, after which point we're going to reassess and see how do we think we're doing? What kind of results are we getting? After that point, then we are going to prescribe another course of treatment and continue to reassess at each stage of the game based on the results that we're getting.
Okay, so how often can I expect to come for those through that 4 or 6 week period for that course of treatment?
Again, it depends on what we're treating and what kinds of results we generally see getting based on frequency, based on the condition that we're treating. So, maybe it's generally always going to be at least once a week for that initial course, sometimes twice a week, depending again on what it is we're treating and how severe the condition is. And then from that point on, again, we make our decision based on the results we're getting. If herbs are the primary treatment method here rather than acupuncture, as soon as we get locked in on a formula, we can start spacing out our acupuncture treatments. They just become supportive in nature. If we're treating something in which acupuncture is the primary treatment method, again, it just goes back to results. We will keep seeing you at the frequency we think that we're getting that's giving us the best results.
Okay, so we've done a course of treatment or multiple courses of treatment. How do we know when it's time to wrap up? How do we know when we're going to be finishing acupuncture or these rounds of treatment? And then what comes next? Will we'll have to ever come back again?
Yeah, that's a great question. So first, let me say one thing here. People often ask me, how do I know if it's working? That's a really interesting question to me, and the answer is quite simple: because you feel better. There's really no other answer to that question. It's working when the condition that you came in for, that the impact it's having on your life is becoming less and less. How do we know when it's no longer working, which I think is kind of your question? How do we know when we're done with treatment? Ideally, actually, we're done with treatment when the condition is resolved. That's the ideal. I don't want to see my patients any longer than I have to. So to me, success is defined on, how quickly were we able to resolve the issue. So that's the first answer to that question. We know we're done when the condition is no longer plaguing the patient. Now, will I never see that patient again? It's likely that I will. If back pain has been a problem for a long time in a patient's life, again, go back to migraines. If migraines is something that's been plaguing a patient for many, many years, then it's not like they'll never have another migraine in their life. Likely the circumstances that were triggers before are still going to be triggers. It's just going to take a lot more of those circumstances to trigger a migraine. So what used to be 10 migraines a month, using our example from last time, has now gone to 1 migraine a month. If stress was the trigger for the 10 migraines a month, stress is likely still going to be the trigger for the 1 migraine a month, right? It's just going to take a heavier amount of stress. It's going to take a lot more to push that person out of balance, created circumstances for migraines. Back pain is another great example. We resolve the issue. There's no more back pain. The patient is pain-free. 6 months later, a year later, they come back. Oh God, I did this thing at work the other day. It flared the back pain up again. In that case, hopefully 2 treatments, 4 treatments, and they're sort of all tuned up and ready to go back out in the world again. And hopefully I don't see them for another year and a half. So they do something else that sort of triggers the back pain again.